Uh, I welcome all of you to today's webinar on the development. And so I think it's exact time that we have to start. We have a good number of people. So thank you so much, everyone, for joining in. I hope this is going to be a beneficial session for you. So just an introduction, I'm Dr. Iqra Ahmed, and I am currently working as a senior registrar in University of Child Health Sciences in Lahore. I initially did my FCPS pediatrics, and I did my MRCPCH in September 2023. I completed that in last year. Um, I gave my exam in Pakistan Center, which was the first time exam happening in Pakistan. And after doing the exam, I have been involved in teaching, and it's been almost a year since I have been in teaching and guiding the students for that, right? So I hope that we have participants here who some of you might have already booked for the exam. Some of you are those who have just started preparing for the exam and just wanted to know the basics and all. So today's session, why did we planned to discuss this development? Because development is one of the most challenging, what I feel, the most challenging station for most of the students, because one way or the other, we are not directly involved in the development. And this is something that we kind of lack at, and it needs a lot of practice as well. But I say to everyone that if you do the development properly and if you have proper guidance for the development station and you are doing it with your full heart, this is like the most, this is it, it becomes the easiest station to score the marks. And you know that this counts for 12 marks in the exam, which is like the biggest station. And if you have really practiced well, if you know that how do you have to take the station, it's kind of I would say it's some kind of mathematical thing that you have to do this and this and this, and then station goes on. So if you do it in that very sequence, it's easier to get to score in this particular station, right? So I'm going to start with the very basics one. Some of you might know all the details that I'll be sharing in the first few minutes. But for those who are new, that would be important to know that what exactly is development station, why is it there, what do the examiners expect, and how do you score in that, right? After that, today, one domain that we are going to discuss is the gross motor. We'll be discussing the history taking, examination milestones. So it will take around like maybe 40 to 45 minutes. And after that, I will open the forum for any one of you to have one practice station in which any one of you can practice one station and we can discuss on that, right? So if you have any questions in between, just raise your hands or just write it in the chat box and I'll be happy to answer all of your queries. So starting with, so this is the developmental station flowchart. Let me zoom it a bit for you. So starting, first of all, you know that each station, this is the station number uh 5 that you get in your station. It can come at any point in your circuit. And firstly, when you have 3 minutes outside the station, in that 3 minutes, you are given a question paper sheet outside, and you have to read the scenario in that. So in the 3 minutes, the initial 3 minutes, the candidate reads the information sheet. It reviews any audio, video, photo, universal cues. Recently, they're not being given. They were being given, such kind of cues were given when the exam was online. And you know that when you are outside, so the tips of doing the development station outside is to just really know that what is the name of the child, what is the name of the parent, what assessment that you have to do, because they are going to tell you that the mother has certain concerns, that the child is not walking, child is not speaking, anything. You have to have that thing. And then they'll be telling you that you have to assess this very domain. So remember, you have to be very clear that this is the domain that you have to assess, because the domain that you have to assess in the clinical, in the practice, you do not have to ask about that in the history station, right? So my tip for that is to just write the names, write the things. And if you have any structure in your mind, if you have any key in your mind that I have to take history in this very way, make that the sketch for you. After that, for the 9 minutes, when you go inside, the station total is of 22 minutes. For the first 9 minutes, what's going to happen is that examiner introduces self and the role player. Examiner provides introductory statement, asks the candidate to take the focus history. The candidate takes history. So you start taking the history when you go inside. You have 9 minutes to take history, right? At 6 minutes, you're going to have a bell and you're going to know that 3 minutes are left. At 9 minutes, the role player who's going to be sitting there, they get up and they go outside and you face the examiner. Then after taking the history for the 9 minutes, you have to tell the history, summary of the history in 1 minute. The examiner asks the candidate to briefly summarize key findings from the history. Candidate briefly summarizes key findings from the history. So this is for just 1 minute. So you need to be very brief, very crisp, good summary for that. For the next 9 minutes, the examiner asked the candidate to describe the steps. You see that now, after in the very beginning of the exams, there used to be a child on whom you had to do a proper assessment. But then COVID came and all the exam went online. After that, the face-to-face exam has started. But even after starting that, the development station does not have a child. Initially, the history is given by a role player. After that, the role player leaves the station, and then you face the examiner, and then the examiner is going, you have to tell the examiner. So you basically have to narrate all the examination that you are going to do, right? So examiner asks the candidate to describe the step-by-step process of how they would undertake a development assessment. So basically, you have to narrate whatever steps you are going to do. Candidate describes the developmental assessment process. Examiner provides dependent cues to candidate during the candidate. So you will be saying that I want to see if the child is able to play with the blocks or make a tower cube. And then the examiner is going to give you a clue that yes, he can make a tower of 4 cubes or 5 cubes. And then you go. So you are going to ask questions step by step, and the examiner is going to give you the cues of that so that you can make an assessment in your mind that what is the age of the child. Then the examiner asks the candidate to briefly summarize the key developmental signs that they have elicited. So yeah, so these 9 minutes is for the examination and telling the findings that you have done. Like you can say that I have examined, like I today I had the chance to play with a boy who is 3 years old. He was able to do this, and this, and not able to do this, or his developmental ages. So whatever your assessment is, right? So after that, for in the last third, then there's a bell which tells that 3 minutes are left. In the last 3 minutes, the examiner questions you about what is the most likely diagnosis, like why there is a developmental delay, any differential diagnosis, then any investigations, management, or any of the questions that the examiner feel like. So this is the exact, this is basic how the station goes, right? Now this is that what you know that in the MRCPCH exam, it is not like that you are marked like it's if the development station is of 12 marks, it's not that the examiner does not mark you as a whole for the 12 marks, right? There are certain subdivisions, there are certain skills that are being assessed. So we'll just go through them. So the first of all, what is assessed is the information gathering, history taking. You are assessed that if the candidate is asking the relevant questions, the sensitively gathers appropriate information, explores main problem concerns of the role player in the structured manner. So 2 marks are for this. Then 2 marks are for the well-structured examination technique, whatever you're telling, appropriate recognition of the requirement of the care taken to adapt the needs of like you have to tell like how are you examining, and appropriate use of equipments, because you see in the development there are certain tools that are being used, there are cubes and everything, and then they are going to assess you that the examination that you are narrating, is it sequence is right, you are doing it right, and how you are proceeding with that. Then 2 marks are for this physical examination. Then 2 marks are for the identification of the clinical signs, which means that whatever the findings examiner is telling, you are able to comprehend that, and you are able to interpret them properly and make a proper diagnostic age, that whatever the age of the child is, you are able to identify that, right? Then the 2 marks are for the clinical reasoning, formulates and proposes likely appropriate differential diagnosis, implication of the findings, able to suggest appropriate steps if the exam is inconclusive, which means that if the examiner is asking about why is there a delay, what investigations or anything that have related to the clinical reasoning. Management planning, relevant investigations to appropriately address the identified problems. So you see in the development, at times there are not a lot of investigations that have to be mentioned. Then provides safe, ethical, effective management plan that relates to the parental concerns, including appropriate referral or the escalation. So you see that these are very typical points that you need to be a safe doctor. MRCPCH wants to be a safe doctor. So you're not going to tell that I am going to do this, this, and this. Whenever you are going to tell a management plan in this exam, you have to involve a multidisciplinary team. Okay, so you have to tell what teams are involved, how are, and also in the exam, it's not just about the problem of the child. It's about the problem the parents are facing, the family is facing as a whole. So you have to tell the management of all of those things, right? And then the communication skills, rapport and communication style, which includes appropriate level of confidence, greeting and introduction, professional, sensitive, appropriate body language, response to verbal and non-verbal cues, develops appropriate rapport, puts the role player at ease, clarify role, share agenda, tone, pace. So even you see that it's not even in this station, the development station, you still are going to be assessed with the communication skills, how you are talking, how are you listening to the parent, the role player, how are you moving forward, are you actually listening to them or not. Okay, so in the history station, in the communication station, in the clinicals or in the development, everywhere in this MRCPCH clinical examination, your communication skill is the key to to be pro at this exam and to secure the good marks, right? So this was the breakdown of all the marks. So 2 marks for each of these, and which makes 12. So you see, if even if you do miss one or two things, you are unable to do the full examination. Maybe you are unable to identify the proper age, or maybe you're missing one or two management planning science. So it doesn't mean that you have not done the station fully and you will be just marked 0 for that. You are going to be marked in each one of these if you are meeting the standard. So you see, if you're meeting the standard, you have done well in that domain, you will get like this meet standard 2 marks. If you're borderline, there's some deficiency that the examiner feels, you're going to get 1 mark. And if there's below standard, then 0 in that one. Okay, so there's a combined. So there are a lot of candidates that we see that we have guided, they get 12 out of 12, and like easily 10 and 11 out of 12 if they have practiced well and they know this, that how to do the development station, right? So moving forward, just a second. Okay. So, in the examination, face-to-face examination, you see that it's a long paragraph. Basically, this is from the MRCPCH site. It basically tells you that you are not going to assess the child in itself. You're going to uh, like uh, tell that you are able to describe a developmental assessment in a focused and a structured manner. And you are examining, obviously, you see, if you see this line, I'll just let me just see this line. Uh, when doing so, being able to share with the examiner what you would be looking for will give the examiner confidence around your thought process, contributing to the developing development of it. For example, I would like to engage with the child to see if they can build a tower, if how many blocks I see. So a lot of candidates who are practicing this, they do say this, that they just you do not act, or they do not tell things as if they are actually doing it on a child. They make it like a question answer session. Like the examiner is sitting and they would say that how many blocks can how tall a tower can the child build. So this is not a question answer session. You, whenever you are examining, whenever you're doing the examination technique, telling it to the examiner, you have to tell it in a way that you are actually doing it. So I would say hi to the, like if I'm telling you that I'm examining a child, so I'll say to the examiner that, okay, I'll say hi to the child, I'll make a repo, see, okay, what are you doing? Do you want to play with the blocks? Okay, I'll see if he's playing with the blocks, and then I will see that is he making a tower with the blocks. So the examiner will say that yes, he's making a tower. So I'll see that how tall a tower is he making, right? So you have to narrate it in a way that you're actually doing it rather than just asking it in a question form. I hope I'm making sense of that. Will go into detail when we'll discuss the assessment as well. Then there, as we discussed about the cues, there are certain cues in the exam, which means that the examiner are going to tell you the findings. There are two types of cues, universal and dependent. The dependent cue means that if you are going to ask that question, only then the examiner is going to tell it to you, right? Like if you, for example, if you are assessing a fine motor and you are going to tell to the examiner that I'll ask him to play with the cubes and I'll see how high can like how high tower can he make with the cube, only then the examiner will tell you that he can make a tower of 6 cubes. If you are not going to ask about the cubes, if you are not going to mention the cubes, the examiner is not going to tell you that, right? So this is the dependent cues. So if a candidate omits a relevant element in the description, the examiner will not provide a dependent cue for that element, and obviously it will depend on the result, on the overall assessment, right? So the candidates should expect dependent cues to be provided where they would have discovered signs or information in real developmental cases. And obviously, yeah, like this is how you are going to practice, this is how we learn all the milestones, and this is how we ask the examiner one by one. Okay. Then there are certain universal cues, which means that universal cues are the signs that any candidate would have discovered simply by being in the room with the child. For example, a universal cue might be if a child has dysmorphic features. These cues typically consist of photographs, but may include audio or video. Generally, now, as I told you, that in the face-to-face examination, we do not get any pictures or any videos. Okay, even for these dysmorphic features, you have to ask the examiner that I'll see that at the child and see if there are any dysmorphic features or any supporting aids, right? So it was usually in the previous era, but not now. You have to ask mostly for the cues that have been met. So I hope things are clear till now. If anyone has any question till now, you can ask, or then we'll move to the gross motor station specifically. Anyone wants to ask anything? Okay. Okay, if not, then we'll move forward. So, what are gross motor skills? I know all of you have an idea that gross motor skills are the movements that we make with the large muscles, like those in our legs, arms, and torso. Gross in this case means large, and motor means movement. Walking and waving your hand are the examples, and the other examples of the gross motor skills include standing, walking, running, sitting upright without a back support, jumping, twisting your torso, bending over, raising your arms and hands, and waving your arms. So all of these are the examples of the gross motor skills. So now basically we're coming to the station. What are the components of the station, and what are the components involved in each part? So as I told you, for the first 9 minutes in the station, you take a history. So, whenever you have a scenario of the development station, there it's written there that you have to take a focused neurodevelopmental history. What does that mean? It means that it is not a very long, lengthy history in which you are going to ask each and everything. You have to be focused, which means you have to ask about the developmental issue that the parent is having, and if there are any other neurological issues with that, and the important pertinent findings or the important pertinent questions that are needed for that. Okay. So the parts of a history basically are when that I like usually say, let me just mute all of you because there's some error. Okay. Yeah. So first one is find the cause of the delay. This is your first task. Whenever you are starting with a history, or your first aim should be that I have to find the cause of the delay. We're going to see that what can be the causes of delay in the gross motor assessment, but you should have things in your mind, and you are going to discover that in your history. You have to probe, ask to find the cause, because you're going to give a diagnosis at the end. Why is this child delayed? Right? So your first task is to find the cause of the delay. Second, detailed birth history. In most of the developmental cases, there's not the cause is not readily found. And then you have to start the history from the birth history, starting from the antenatal, natal, postnatal history, and then discussing all of the possible causes that could be causing that delay. So birth history is really important. Then development in other domains. So this you need to be very careful about. Like if we were discussing gross motor delay today. So if we have to assess the gross motor in the developmental station, it means that you cannot ask any question related to the gross motor development in your history. Okay, you have to assess it in the second part of the station, which means you're not going to ask about his standing, walking, running, any of those things. Usually, even if you ask these, the role players are well prepared and then going to tell you that you're going to assess this in your station, right? But be careful not to ask it because it can give a bad impression. Then is associated important history points, and then is the psychosocial history, right? So these are the components of history that are important for you to have a composed, a good history, which is really impressive and which is going to help you in answering all of the questions. So finding the cause of the delay, we'll discuss each point. Finding the cause of the delay, firstly, obviously, you ask about the concern, that what is the concern of the mother. So it might, if since we're discussing the gross motor today, so it might be that the child is not walking, the child is improperly walking, he has a funny walk, he's unable to move, or maybe you have a child who's an infant and mother child is not able to crawl or sit or stand or any of the gross motor issues, right? So it can be any of that. So whenever there's a concern, then you have to establish the fact that is it a delay or a regression, which means that you have to assess that whether the child attained any of the skills that he has lost, or the child did not attain any of it, right? So you have to establish the fact that is it a delay or a regression, because that can be different causes for that. Then you need to ask that is there a specific point of time, like if there's a specific time when the mother noticed that there's something wrong, or since it's a journal thing that it has been happening since the beginning. Because if there's a specific point of time, like mother tells you the child is 4 years old and the mother tells you that I noticed the problem maybe at 1.5 years of age, then you have to move around that. If there's a specific point, you have to ask around that specific point, that what went wrong at that time, was there any injury or any of those things. You have to ask detailed history at that point, right? Um then, keeping the causes of gross motor delay in mind, you have to ask them about them in the history, which can be multiple causes, starting from birth to onwards, any injury, any infections, any trauma, any surgery, any of those things that can cause the motor delay, or this can cause the regression, a problem in the motor skills of the body, right? If as I told you that if there's a specific point, you have to ask around that point. But if there's no specific point, like the mother says that the child has always been like this, he did not attain this, something like that, then it's better to start your history from the birth and then from the antenatal, natal, and then move forward. Okay. Then also you have to ask the different features, which means that feature means the facial features, right? Because a lot of syndromes come in. Recently in the Pakistan Center, we had a case of the Sturge-Weber syndrome, in which when asked, the mother told that the child has this facial rash, and it was very particular of Sturge-Weber syndrome, right? So you have to ask if the child looks like you or the father, or he looks different, to see if he has any syndrome or any of those things.
نعم
Any,
مين
sorry, yeah,
اه
please mute all of you. Please just keep your mics mute so that we do not have any interruptions in between. Okay, thank you. So then the facial features and then the skin marks, because you see the neurocutaneous syndromes, including the Sturge-Weber or maybe neurofibromatosis or any of the other syndromes, any other neurocutaneous syndromes that can come. So skin marks, having skin rashes, skin marks, this is an important thing as well. So with all of these questions, if you are going to ask all of these systemically one by one, I'm pretty sure that you're going to find the cause. And once you have known the cause of the delay, it's really, you feel better, and then you can move to the next part. So the next, as I told you, birth history, it's really important. Antenatal history, in which you need to ask about the medication that mother took, any alcohol, any drugs, antenatal scans, any complications during the antenatal period. Then in the natal history, you need to ask about the birth, type of birth, why weeks at which he was delivered, and spontaneous cry was not. In the postnatal, you need to ask about any resuscitation needed, any jaundice, initial birth screening was done, any issues with the feeding or any of the other things, right? I know you must know all of these questions. So antenatal, natal, postnatal, it's really, really important to ask about the history, because I can tell you, like, more than 50% of the cases or the recalls that have been coming in the exam, they usually have something going on around this birth history, and at times you would find some good cause around that. After that, these two important points, once you have found the cause and the birth history is done, then you need to ask questions about the developmental assessment of a child in other domains, which means that if you are going to assess the gross motor, then you need to ask about the fine motor, the hearing, speech, and language, and the social, right? So other domains have to be assessed to find out that does the child have an isolated one delay, or the child has a global developmental delay. We call it global developmental delay when there's a delay in two or more domains. So any of those things. So you have to have it. You do not it like it's not that you should not spend a lot of time on this. I've seen a lot of people who spend a lot of time on these questions, and then they are able to cover other part of the history. So what I suggest is ask 2 to 3 questions max per domain, to just have a rough idea about the age of the child in the other domains, and to have a rough idea that is the child delayed or not, right? So you might not be able to exactly pinpoint the age of the child in the other domains, but you need to have an idea that is it age appropriate or is it not, right? So 2 to 3 questions per domain, you can like write them down, you can have them in your mind or any of those things, and then you need to ask about those. Then other history points, it depends on the case to case. It depends on what points need to be asked. Like if there's a child of Down syndrome, you might have to ask about the other medical issues. You need to ask about the medications, because a lot of, like, if I would tell you the Sturge-Weber syndrome, the child has fits. You need to ask that, is the child taking the medications properly? Is the proper follow-up being done? Because one of the causes that at times is mentioned in the developmental station cause of the delay is the neglect of the child. So with all of these things, you need to
Yeah,
you
thank
do
you.
need to have an assessment that is the mother properly taking care of the child, and is it like medications are being given. Then any investigations that have been done, if the child had any meningitis, any asphyxia, any of those things. So was there any brain scan done? Like if the mother knows any results of any of those things, so you need to ask about that. Then past surgery, there have been cases when there was a tumor, SOL, and it was resected, and after that the child had the gross motor difficulty. So you need to ask about that. Teams involved, like if the child is have maybe the like you can get a child who's having fits, and you need to know that if the child is on a follow-up of a neurology team, or the child, there are at times there are children who are already on therapies but they're not very well doing well on that. So you need to know that if there's any, maybe if there's a case of Down syndrome, so you need to know that if the child is having hypothyroidism, or the endocrinology team is involved, the cardiac team is involved, any other issues, right? And the nutritional history, if needed, there, I think once or twice there have been cases of the rickets and the gross motor delay, in which the nutritional history was important. So you see, it all depends on case to case. Nothing is fixed in that. Other than these, like the vaccination history, it's not very important. If I'd say, if you are running late and you do not have a lot of time, you might miss a few points in these, right? But the other things that I mentioned, that the cause of the delay, birth history, developmental history, you cannot just skip that, right? So this is like something which you can like increase or decrease depending upon the time and the type of scenario. Then psychosocial history, never ever ever miss this one, because you see, I've seen people who spend a lot of time on assessing about the development questions, who spend a lot of time on asking about the cause of the delay, and they're asking about, as I told you, the other unnecessary, the vaccination history, the other kind of history, and then they forget this. This is not accepted, because you see, the children who are developmentally delayed, they have real problems. The parents are really upset, and then they need to have this impact of disease. So you need to have a good family history, knowing about the maybe the consanguinity, number of kids, any other issues in the other kids, then impact of the illness on the parents, on the child, on the siblings, that how are they coping, who is taking care, how are they managing, if they're doing jobs or not, who's earning, and how is everything being affected financially. Then the financial impact, you can ask that who's earning, how are they managing, are they getting any help. Then you need to ask about the support groups, if they have joined any allowances that have been given to them, disability allowance, or any of those things. So psychosocial history is important one. If at time you feel like that your time is getting less, then maybe skip something from this slide. Okay, but do not ever miss this psychosocial, because you see, this is not just asking whenever you're going to tell your management, you are going to tell management about the delays, about the problems of the child, and then you are going to tell the management of these issues that come, right? So it's really important to never ever miss this history. So just revising again, that we discussed that there's find the cause of the delay, all these points, the birth history, developmental assessment in the other domains. This is, it's not basically assessment, it's asking the developmental questions, other history points, and the psychosocial history. After that, the 9 minutes are over. Then the examiner is going to tell you to summarize. So you see, 1 minute is a very less time. You have taken history for 9 minutes, and now you have to tell all of the findings in only 1 minute. So you need to practice for this, right? So the five parts that I've mentioned in the history, you have to tell one sentence of each part, like the cause of the delay, what happened, why it happened, when it happened, background of what investigations, or like the development assessment, birth history, psychosocial impact. So just give like 15 seconds to each other the main and tell. So you need to, whenever you're practicing with your friends, whenever you're practicing with your partners, I would suggest you to write down your summary and speak it out. Maybe record it in your voice in your phone and then listen to it, so that you know that you get to know that one. Because you see, more or less, there are similar kind of things. You just need to have a pet or regular format one statement, and then you're going to change it according to your scenario. So the summary should be really good. After that, your next 9 minutes start, in which you are going to have an assessment. So the assessment start, as I told you, that after the history, the role player leaves the room, he or she goes out, and then you're facing the examiner. The examiner has this key in his or her hand, in which all the cues are being mentioned, and then you have to like start with, I'll ask the permission from the mother. I'll build the rapport with the child, and maybe you can use it the sentences like hi, like if I'm saying the hi Adam, how are you? Okay, so I'll see. So these are the journal assessment. You'll see that journal look of the child. So you'll ask that, I'll see that is the how is the child, and is the child well looking or the sick looking? Is what is the posture of the child? What is the child doing right now? Is it sitting, standing on mother? Are there any dysmorphic features that I can see? So they might tell you that child has this uh, small head, or as I told you, the Sturge Weber, that this child has rash on the face, or any of the things that are visible. So that's their aids. You always have to ask that if there's any like wheelchair or any other aid present around, or glasses, or any other thing, hearing aid, any other things that are present. And you need to ask what is the child doing right now, because whatever the child is doing, you need to uh, like start your assessment, and you have to modify your assessment according to that. So whatever the child is doing right now, you have to. So you're going to get a lot of information. You're going to have a journal like this. So whatever you are, you need to be clear about this, that during the assessment you have to be very receptive. Okay, you need to, it's not just about asking questions, it's about listening to the answers and having a journal perception in your mind, and then interpreting that. So that comes with the practice. Keep practicing with your colleagues, with your friends, and to have an idea that whatever the next person is saying, you are able to interpret that, and you are able to make a story in your mind, or you're able to make a picture in your mind that this is a child, this is the features of the face, and this is how he or she looks, and this is how the milestones are, right? So that you can have an idea about that. So this is about the journal assessment. Then in the gross motor, you know that there are certain things that you have to assess. Okay. So the journal things that we assess in the gross motor are, you generally start with is whatever the child is doing. If the child might be sitting, it depends on the age as well. Obviously, if the child is 3 to 4 years or like above 2 years, first thing that probably you ask is about the standing and then the walking. So if the child is able to walk, then you next, there's after walking, there's running. After running, there's you can ask about jumping. After that, you can ask about walking upstairs or the downstairs. After that, you can ask about kicking a ball. Then you can ask about the child is still doing all that, you can go move forward. So you see, always remember that you have to ask a journal thing. Like for the gross motor, usually you ask about the walking. So if the child is able to walk properly, then you move to the next part, right? So that is the child able to run? Okay, if the child is not able to walk, then it does not make sense that you ask about the running. Okay, it would look, you will look bad that the child is not able to walk and then you ask him about is the child able to run, because if the child is not able to walk properly, he would not be able to run properly. And obviously he's not more, he might not be able to jump or like do things like that. Okay, and then asking, you cannot ask about hopping or maybe tricycling or things like that. Then you can ask about the upstairs downstairs, it because they can tell that you that one foot both foot. Okay, and then about, you see, always remember that when only gross motor is coming, it gets a bit difficult because a lot of you are not very used to do the gross motor in detail, like because in the fine motor, you see, there are multiple things that you have in your mind that you're going to look for the blocks, and then you go for the scissors, cutting, drawing, and that's the easier one. For I've seen a lot of people who gets to have a block when there's only gross motor. So you need to know all of the milestones. You need to practice them really well. Usually we divide the gross motor ones into the ones which are more than 1 year, and then there are that below 1 year. Below 1 year is a whole different kind of an assessment. Infant assessment does come in the exams. You need to revise that again and again, again and again, to have a good concept of how you're going to process, right? So usually for the first for today, we are mostly be discussing about above 1 year. Okay, and then you can have a good read about the infant one in as well. So there are a lot of charts, a lot of notes that have been circulating around. I did not put it here because that are not my property. The one I've mentioned are the official, from the official website of the RCPCH, or the book that I have used. But if you have other charts and you feel free, that you feel that they are better, you can obviously use them. But let's just go through this. So sorry, I'm muting everyone. Okay. So starting from, so yeah, so let's just make a line that it's below and above. So let's go from here. We'll discuss the above ones maybe later on in some other session. So at 12 months, the child is able to walk alone. 18 months is the upper limit for the walking. Okay. So the 8 month is the threshold for worry. If not, then there's Duchenne, muscular dystrophy, hip problems, cerebral palsy, etc. Running is at around 16 months. Jumping is at 18 months. Running tiptoe at 2 years is running on the tiptoes. Walk upstairs, both feet each step. Um, Throws ball at the shoulder level. So always remember one thing. One thing that people usually seem to forget is that during the gross motor, they're only assessing about the lower limbs. Okay, so they're asking about the walking, running, kicking ball, but they kind of tend to forget that you need to kind of assess the upper arms as well. Obviously, you can because there can be discrepancy in that. You can have a child who's cerebral palsy, who's diplegic, and he has a weakness in his lower legs more rather than the upper limbs, and the upper limbs are the kind of spared. So you would have that upper limbs are stronger, they are able to do certain things, but the lower limbs are not able to do certain things. Okay. So you see that throws ball at the shoulder level comes at around 2 years of age. Then 2.5 is the kicking of the ball. 3 years hop on one foot, walking upstairs 1 foot per steps, and then 4 years walking up down in an adult manner. Okay. So giving you a tip that usually the child or the chronological age of the child, it might be 3, 4, but usually in the exam, I haven't seen cases in which the developmental age is above 2 years. Developmental age is usually below 2 years. It's mostly move around 12 to 18, 24 months, or if there is this infant, it can be 9 to 12 months, or at times 6 to 9 months. So you need to know the milestones till the 2 years of age very, very, very well. Okay. Okay. Someone has messaged in the group. If you want to ask any question, please just write down your question and I will be able to reply to that. Okay. So these charts, these are really important. Okay. You can use any that you find comfortable, but always confirm whatever you're reading that is like proper one. So I've added, this is one is from the Mark BT. So you see at the 18 months, they've mentioned there's running, bending over, walks, carrying the toy, pushes, pulls, climbs onto the chair. So you can ask about if the child able to climb on a chair or on the furniture. At the 2 years, it stand on the tiptoes, squats and stand up, jumps up in place. At 3 years, it's walking on the tiptoes, briefly stands on one foot, jumps with both feet together, runs fast, rides a tricycle. At 4 years, a child is able to hop, stand on one foot for 3 to 5 seconds, ask mother if a child can climb the ladder. So gait, if you need to, okay. So one thing that whenever you're asking about the child, that is the child able to walk, and the examiner tell you that he is able to walk, then you need to ask that what kind of walk is that, okay? Remember one thing that some of at times we get swayed, like when at times we in the history we get to have an idea that this child has cerebral palsy and there are upper motor neuron issues. So it becomes a tendency to just go towards the neurological examination. So at times the candidates in the assessment go towards the neurological examination, and the examiner tells you that remember this is not neurological station, this is a developmental station. So you do not have to go in the details of a lot of things, meaning that tone, power, reflexes, not you won't not do that. But when the walking, so imagine yourself that if you are doing a developmental assessment of a child and he's walking, so just by looking you will be able to tell that what kind of walk is that. So you can ask the examiner, and you need to ask the examiner because the gate is going to tell you a lot of cues. Like if there's a child is of the DMD, if the child is of CP, diplegic CP, hemiplegic CP, any of those things. So the child will be able to, you will be able to tell that what's wrong by just looking at the gait. So whenever there's a gait, the child is able to walk, you need to ask that what kind of gait is that. So gait, broad-based gait is present at 15 months, at 18 months, purposeful and the confident gait. Ball skills are that the child is able to kick the ball by 15 to 24 months of age, can run to kick a ball at 4 years, bounces and catch ball at 5 years. Stairs, the child can crawl upstairs from 15 months. Child can go with help, holding on to adult's hand at 21 months. Climbs with 2 feet per step, holding on to rail for 2 years. Climb with 1 foot per step, 3 years. Descend down with 2 steps with 3 years, and up and down by 4 years. The child is able to do the adult one. So this is something which is not going to be learned in one sitting. This is not going to be memorized just by reading one. This is something which is has to be done again and again daily over the period of times. The candidates here who are planning for the next diet, I would say to just do these whatever charts you're following. You need to look at them once in a day. Definitely do one chart at like maybe just give a 5 minutes and just look at that, because you see when you are in exam, it's not just about what your mind is remembering, it's about your pictorial memory as well. So if you're looking at a chart again and again and again, then it will be whenever you are sitting in an exam, you will be able to just remember that what did you see in this chart, and you will be able to tell that.
11.
Okay, then keep on practicing. Like how do you practice? Whenever you're sitting, maybe you have some time, just think in your mind all the milestones that an 18-month-old child can do, and just say it from your mouth so that you are able to verbalize it. That's how you will be able to do things on you will be able to memorize things. Okay, so this is something which is going to come to you after a lot of practice. But if you do practice well and if you get hold on to this, then I show you that getting marks in this one would be really easy for you. Then this chart is for the infant milestones. As I told you that infant milestones are a bit tricky. They they do not come very often, but they have come in the exams. We have recalls. In fact, in one of my exams, this scenario came as well. So you need to have a good idea of that. But first focus on the above 1 year one. When you are done well with that, then come to this one. And then again, the trick and the tip is to just read them again and again, look at them again and again, and keep on memorizing and revising in your mind, right? So that you are able to do all of this. So after you have done this, after you have done your examination, you are going to explain your findings, structure your presentation of the developmental assessment into different areas, be systematic. First comment on the developmental age for each area. They've just in this paragraph they've mentioned the journal one, but whatever domain you have assessed in the area of gross motor skills, he has a developmental age of. So you have to tell it like this. So today I was able to play with John, who is has a chronological age of 4 years. But in the area of gross motor skills, he has a developmental age of 18 months because can he was able to do this, and this, but he was not able to demonstrate this today. Okay, so you need to tell it that. So you'll tell that the child is delayed, and because he was not able to do that, and then you'll viva will be proceeded. So after you have told this one that what is the developmental age of the child. Okay, so remember that you do not have to tell a typical one a day. Like you do not have to tell one exact point of time. You have to tell a range, okay, roughly. So above 1 year, if you are having a developmental age of more than 1 year, so you need to tell a range of around 6 months. So like you can say 12 to 18 months or 18 to 24 months, 2 to 2.5 years. So you do not have to tell exactly, because whenever you're going to assess, it's not going to be that all of the milestones are fitting exactly into one age range, one age, 1 month. They're going to be ranging over a few months. So you have to have a balance between them, that what, like, some might be, the child might have uh, skills of 2 years, but some of 18 months. So you need to give an average range of 18 to 24 months. Okay. So after that, you're going to have a discussion with the examiner about the cause of the delay, differentials, whatever the causes can be. Like if there's a CP, they might ask you about what kind of causes of cerebral palsy. Then the investigations that have to be done, management plan, that what you do, as I already told you, that you need to tell about the multidisciplinary team. You need to have a discussion about all of the involved professionals. Then the MDD, you need to mention any medical professionals that are included, like if there's a neurologist, any other one, geneticist, then the physiotherapist, occupational therapist, speech language therapy, social worker. You really need to know the roles of all of these. You need to have lines prepared, well learned, because these are the typical questions of the development station, that what is the role of physiotherapy, what is the role of occupational therapy, speech and language. You can find them online, but you need to have a good document of all of these, that what do they do, right? And after that, yeah, so this is the last 3 minutes. There's not an extensive discussion. There's a journal 3 minute discussion which goes on very typically in very early and very smooth matter, if you have done the things right. Okay. So, the common gross motor scenarios that have been coming, the recalls include the cases of the cerebral palsy, which can be hemiplegic, diplegic, monoplegic, any of those, shaken baby syndrome, post-meningitic sequelae, rickets, tumor resection, and then multiple syndromes, including the Sturge-Weber, alcohol fetal syndrome, tuberous sclerosis, or things like this. So this is for the presentation. If you have any of the questions, I think we can have a few questions before we can move to the practice. So any of you want to ask anything? We have a good number of participants here. So I believe that someone should have some questions. Feel free to ask any questions. I really want to tell you that I know everyone does get some question in their mind, and they feel like that might feel stupid to ask questions, but let me tell you that questions are really, really important to ask. Yeah. So I think someone raised hand.
Thank you, Dr. Ikra, for a really nice presentation. I want to ask, like, if there is a motor command, we have to assess all the other domains like fine motor, social, and cognitive.
Okay, no, you need to be very clear with the statement. They can give you that you have to assess the gross motor. If they have written that you have to assess the gross motor, it means that you have to assess gross motor in the second part, and the other three domains, the fine motor, hearing, speech and language, and the social, you have to ask the questions regarding to them in your history station. Okay, that's one thing. They can only ask you about the fine motor as well. So if they have mentioned that you have to assess the fine motor of the child, then you have to assess the fine motor in the second part and ask about the other domains. If they have written only the motor, that you have to assess the motor system, or like you have to assess the motor domain or the motor skills, then it means that it's both gross motor and fine motor, right? But if they mention motor, then obviously you do not have to assess the social and the other one, all of the things. So the multiple words used are either gross motor, it can be simple fine motor, it can be only motor, which includes both gross and fine motor. It can be you have to assess social, speech and language. It can be that you have to assess both social and the speech language one. And it can be that you have to assess the cognitive assessment, which includes the speech and the social one as well. Okay.
Okay, thank you so much. Yeah,
Okay.
sorry.
So I think we have another question. Can you give a summary of a gross motor assessment in a child less than 1 year? Um, Summary, what do you mean? Like, do you want to do you want me to tell me how would we present that? Because as I told you that, uh, you see that less than 1 year, it's a bit of a different topic which needs another one session. Maybe we can plan another session. But you know that if you go through the chart that I've mentioned in the mark BT, I really like that one. Even for my exam, I did that chart in whole detail. So when you're assessing an infant less than 1 year child, you need to establish that is the child able to like, if the child is not able to stand, is the child able to sit? If the child is able to sit, then you need to ask about the crawling, you need to ask about the rolling over. Then you see the 360 maneuver that we do, that you have to first see the patient in the supine position, then you have to hold the position child in the ventral suspension, then you have to lie the child in the prone position, and see all of the things that are mentioned in the chart. Okay, so I've noted your suggestion. Maybe we can have another session about that. If you have any other specific thing that you want to ask, then please message. Someone else, Dr. S. You have asked that I want to ask a question. Yes, please.
Yes, thank you, Dr. Ikra. It was a wonderful session. My question is that you mentioned that we have to mention about the impact and also ask them that how the parents are managing, treating the disease. Are they having any support from the government or the health insurance, etc.? So, in another session, I heard somebody saying that we are dealing with cases in UK, and it's stupid to ask that if they are getting any financial help from the government or any help for the child's treatment. So, please kindly make this confusion correct. Like, if are we going to ask them about? The any help or the health card or the health insurance, or we are just
Okay.
it's like understood for us that they are getting
Okay.
it.
I think what they must have told you is about the insurance, the typical insurance question. They might have told you about that. Because yes, the people say that some people used to ask, but you see that, yeah, that makes sense because in the UK, the people have health insurances and things like that. It's a journal question that you have to ask, that are you getting any, because you see there are certain disability living allowances if the child is not well, so there are some additional allowances. So you can just have a simple question, that are you getting any aid or any help or any support from like again any additional support, simple thing like that. You do not have to mention the word government. You don't have to ask, you do not like need to ask like specific organization, just a simple question, that okay, so I know this if I tell you that, how do we ask that? You don't obviously ask that who earns and how much do they earn. So you see that, okay, so you and your partner, they're living together, so what does your partner do? So who takes care of the financial things at home? Do you feel that um the income is sufficient for your family? Are you getting any support from anywhere? That's it, right? You do not have to find the source. You do not have to find the exact amount or things like that. Health insurance, specifically asking, doesn't make sense. That's right. Yes.
Okay, Assalamualaikum, ma'am.
Alaikum assalam. Yes.
I want to ask regarding the assessment. For suppose if we are getting any specific domain to assess, so in that case, neurofibromatosis or tuberous sclerosis or Sturge-Weber syndrome, so in that cases there are few findings on the skin. So in that case, can we ask the questions from the mother or the role player?
Specific what question are you?
Like when we are assessing the child, so without like an Sturge-Weber syndrome, there is a port wine stain. Without that, we cannot make a diagnosis. Or when we are
Yeah, so if I tell you
looking at
about the recent exam in with which the Sturge-Weber syndrome come, so you need to see, you need to ask the journal question. So what you would say, does the child have any rash on the body or any mark on the body? So in this typical
oh,
the Sturge-Weber one, the mother in the history told yes that the child has this mark on his face and is red in color, and along with that she gave the history that the child is having fits. Okay, then in the cases, some other cases of maybe tuberous sclerosis, if you're asking about the rash, the child, the mother might tell you that she's having this typical kind of rash. Okay, so if you ask about that, you should have this in your mind, because as I told you that neurocutaneous syndromes, they are important and they do come. So asking the journal questions, similarly, if, about the dysmorphic features, this, it doesn't look nice that if you ask that is your child, like how does he look, something like that. So how do you ask is that, does your child resemble you or his father? Okay, so in this
right.
is a way of asking that if they, if the role player has been told that they need to tell about certain feature, if you ask in this soft, like mellow way, they are going to tell you that, yeah, the doctors told us that, yeah, we feel that he does not resemble us, he's a very different kind of face or thing like that. Okay, so you need to ask the general question and they are going to tell you about that.
Oh, thank you,
In the
ma'am.
assessment, if you are, whenever you're doing the assessment, so specifically the Sturge Weber, when you are going to ask the examiner that am I having a journal look at the child, and I will see that is there any typical mark as told by the mother, so the examiner is going to tell you. So there's a difference, there's a slight difference in different centers, there's a slight different in the different like examiners as well, a bit of something. At times, if you simply ask them to have a look for any dysmorphic features, they tend to tell you a lot of things, okay? Any obvious findings. But I have had reviews that at times certain examiners give this review, or they tell that you need to be specifically asking about that, what are you looking for, okay? So these variations do come in, but you need to ask about, you can generally ask about the dysmorphic features and they're going to tell you something which is important to tell, okay?
Okay, and lots of the syndrome, they can present in the same way. So as you said, it seems to be quite rude to ask from the parents, does it looks dysmorphic? And in a soft way, if we are asking, so is it necessary to give an exact diagnostic
Okay.
syndrome, or we can
So
simply
you
say
see,
that any
if they
syndrome?
have a, if they have a syndrome, then they're going to give
Mm-hmm.
you some information which is going to lead you towards that syndrome. Okay, because
Oh,
it's not that they're going to tell you something very rare. If you go through the cases, I think mostly that I have found is the fetal alcohol syndrome, the Sturge-Weber syndrome, tuberous sclerosis. Maybe in one or two they had the Dajor syndrome, in which they give, and very rarely, I think one or two they had this different, which was in a previous stations as well. In the recent past, I haven't seen some very odd or some very difficult or some very rare kind of disorder coming up. Okay, so I don't think that's
oh,
going to be much of an issue, because even if it's syndrome, right? Even if syndrome, there's always going to be some other reason for the delay. Like in the Sturge-Weber, you know that why is there a delay in that? Because there are fits going on in there, due to which there's hypoxia, and then there's neurological involvement in that, and that is going to cause the delay, right? So they are going to lead you towards that why typically is the delay in that case. Okay.
Oh, thank you, ma'am. Thank you so much.
Okay, so someone has asked that, is it necessary to present developmental age in the history? Okay. Uh, it's it's again examiner dependent. Some examiners are happy with this, that even if you give it just that the child is delayed, right? But I believe that you should have an idea of what's the age of the child. As I told you that if you ask two proper questions, like if I tell you that if we are do have to assess the gross motor, and in the exam in the history you're asking about the fine motor, so you ask about the what the child can draw and how many blocks tower can he build. With these, only these two questions, you can be able to make the age of the child. Then in the hearing speech language, you can ask that how many childs can, like the child can speak, is he able to tell his name, age, or thing, right? Would be expressive. And in the receptive, you can ask that how many parts of the body child can do and how many commands. So with these two questions, you can be able to tell that what's the expressive and the receptive speech. Again, in the social, the eating pattern, or again, and along with that the feeding pattern, and along with that if you're like going to the button and button one, or the toileting. With these two questions, you are able to tell what's the age of the child. So it's better to tell the age of the child, age range, and tell that is there delayed or not, so to have a good impression on the examiner as well, and be clear that is there a gross delay or not. Yes. Okay, Dr. Ravirala, so you have asked that, can you give an example of a statement of summary of a 2-year-old gross motor assessment, like a normal 2-year-old child? Okay, yeah, yeah, I'll do that.
Yeah, yeah. Just to
Okay,
know how
I'll just, yeah, okay, I'll just do that. Yeah, okay, just give me a second of, I'll see the, okay, okay. Okay, so you see that if maybe you have a child who is having an age of 4 years, okay, and during the assessment you see that the child is around 18 to 24 months of age, okay. So what you will be telling that today I get to play with John, who has a chronological age of uh 4 years. Today, I could see that the child was able to walk, and he was able to walk forwards and backwards, and was able to run smoothly. He was able to jump at a place, and also kick on standing, and he was able to throw a ball with his hands. And on asking, the mother told that he can go to go upstairs 2 feet per step. So on the basis of these findings, I would say that he has an age of 2 to 2.5 years. And I would like to do a further assessment for that. So you see that you need to, in the gross motor, you need to tell about the walking, the forward, backward running. If at 2 years the child jumps, so that comes. If not, then you're not going to. Then kicking, then the upper limb movements, then the stairs, and then if there's tricycle or bicycle present or not. Okay. Okay. So, anyone has any other questions?
and ma'am, before
Yes.
assessing, do we need to mention to the examiner that I am going to use these materials for the assessment?
Yes. 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 So for the gross motor, there are not a lot of materials that you need to use. There's hardly a ball that you can use, right? For the fine motor, yes, you're going to tell you that you're going to tell there are things present there as well. You can just pick them as well, or you can just tell them like I'm going to take these toys and play with them. And then whenever you are going to do one thing, then you are going to tell that I'm going to take that thing away and give the other thing, so that the child is able to focus on the next thing. Okay, so in the cases of the diaplegic CP, the examiner is going to ask you very specifically that what age does he wants, right? So yes, there's going to be a discrepancy between the upper limb and the lower limb. the examiner most probably would say that what is the assessment according to the lower limbs. So if the examiner say this way, then you are going to tell it. If not, then you're going to tell that because that child is having, like, most likely he's diplegic, he's have weakness in the lower limb. So the age range, yeah, or the developmental age according to the lower limbs is this one, right? And if the child, you see, the upper limb usually does not come before 2 years. So if the child is able to do that, if the child is above maybe 3 or 4 years and you are able to demonstrate something which is higher in the upper limbs, like the throwing and all that, you can mention it separately. Yes. Like in the recent exam, I will tell you that the Sturge-Weber syndrome, I think Sturge-Weber or something. No, I think in one of the cases where there was a tumor section, I had a feedback. So the examiner said that, okay, so one part of the body, one side of the body of the child was not working at all. So the child was not able to do anything from that. Supposedly, the child was not able to do anything from the left side, and the right side was a bit delayed as well. So the examiner said, okay, give me your age according to the right side, because obviously the left side is not working at all. So you need to give the age of the right according to the right side, whatever the side is able to function. So the examiner is going to tell you or guide you that what age you have to tell. Okay. But yeah, there's going to be discrepancy in that one. Okay, so if we don't have any other question, do we have any volunteer here who would like to practice? We have a scenario, and I did plan that we will do a practice scenario. If anyone would like to volunteer, I would be really happy.
Can I try it, ma'am? Murtaza.
Okay, sure. Yes. Okay, so you do know the pattern. So I'll just give you the scenario. We'll just have this in a proper 22 minutes station, and then we can have a small discussion on it later. Okay. So I'll be giving you the scenario, and then you will have 3 minutes to prepare for it. Okay.
Okay, ma'am.
Yeah. So this is your scenario. Please, you have 3 minutes to prepare, and then we'll start. Okay, your time for history has started. Please start the history.
Good afternoon. This is Dr. Murtaza, one of the child doctor on duty today.
Good morning, doctor.
Good morning. Am I talking to Mona, mother of 3 years old Raza?
Yes, doctor, that's me.
So, Miss Mona, I am here today to discuss about your concerns about Raza. So, during our discussion, is it okay if I jot down a few points when we are
Yeah,
discussing?
that's yeah, that's fine, doctor.
Thank you, Miss Mona. So, can you just tell me about your concerns about Raza? What is the issues?
Yeah, doctor, I'm really worried about him. I mean, he's not really doesn't walk properly, and yeah, a lot of other issues. But right now, I'm really concerned about his walking and moving around.
Yeah, I do understand your concern, Mona. So, can you just elaborate, like, what is, like, how is he walking through? Like, is he able to walk with support, or like, what is the main concern? He is not walking, or was he able to walk before he has, stopped walking now, something like this?
I don't know. I mean, he has difficulty moving around. That's my major concern.
Mm-hmm. Okay. And so for this, what help have you taken? He's like being seen by some doctor.
And we are on a follow-up of GP, and he's been telling me to just wait. And yeah, I've been waiting, and then we had some moving around, and I could not really go to the GP for the last few months. And now I again went to the GP, and then he referred me here that he needs proper assessment.
Okay. So is he under the care of any other doctor along with the GP?
Yes, he is in the yeah goes to the brain doctor uh, because of the issues that he's been having. Like he has fits, and due to that, he's going to the brain doctor.
Yeah. So and what any investigations have been done for him for with regards to his concern of non-walking and fits?
Not specifically to this, but yeah, he had issues when he was around 6 months of age, when he got fever and had fits for the first time. And that time he was admitted, and multiple blood tests and some other tests were done. Yeah.
Okay. Right. So for this fits, he's taking medicines for this fits for since
Yes.
6 months, and are they
Yes.
controlled with those medicines?
Yeah, he didn't have fit for I think last 5 months.
Yeah, that's nice to hear. And with regards to his Raza, can you just tell me, like when you were carrying Raza in your tummy, were your scans all done properly, and like any concerns in the like when you were carrying the Raza?
Not really. Things were okay. I did go for the scans, and the doctor said that he's doing okay.
Okay. And it's like something like private. Were you taking any like alcohol during like when you were carrying
Oh,
Raza?
no, no, doctor, nothing like that. No, I was very careful.
Okay, that's quite good and like a concerned mother. So, can you just tell me about his Raza's birth? Like, was he born at how many weeks of like pregnancy? Was he born at time
Yeah,
or?
he was born on time, and it was a normal delivery, and nothing specific happened at that time.
Yeah, yeah. Okay, and he cried after birth and everything was good. He was
Yeah,
discharged.
everything was smooth. We were just discharged after a few hours.
Nice to go there. Is know that his heel prick test results were normal. Were they
I
done?
think yes. I think that nothing was mentioned.
Okay, nice to learn that. Do you think Raza, whom does Raza resembles? He resembles you and his father?
Yeah, he's more like his father. Yes.
Okay. With regard to like previous history of Raza, yeah, like you have been telling me that at the age of 6 he had fever and had fits, and he was admitted during that time. And after that, fits medicine has been there. Can you just tell me any other time he has been admitted in hospital previously, after this or before this?
Not before this. After this, yes, once. or twice due to his fits, which happened a lot, and they were not getting controlled.
Mm-hmm.
So,
Okay, I do understand. And for that, any tests were done, for the investigations were done for him?
I don't know. Every time they do check the medicine levels and some other blood tests, but they say that like when he was 6 months old, something happened to his brain at that time, and was some bug in his brain, and it affected him, and that's why he's having all of these issues.
Okay. He didn't have any surgical surgeries or shunt operations.
No.
Nice to learn that. And with regards to like his like how is has been like Raza, if I give him is he able to draw some shapes on paper? Like does
He can make lines. I've seen him making some straight lines. Yeah.
okay. And with regards to his like language, like is he able to tell his name? Is he able to
Three
tell?
minutes left. 3 minutes left. Yep.
Is he able?
No, he's not able to tell his name. No.
Okay. And when you give him commands, is he able to do like if you give him commands, is he able to follow them? Like two
I
commands.
mean, I feel he understands, but as I told you that he has difficulty moving around. He cannot move around. So it's
Mhm.
difficult for him, but he does understand if I tell him that you do not have to do certain thing, I stop him from something. He knows that.
Okay. Right. And with regards to his play, does he share his toys while playing, Raza?
No.
And, how does he feed himself?
Yeah, he can drink with pop, and other than that, I feed him usually.
Okay.
Ayama can
With
unmute.
regards to your family members, how many family
Just
members?
a second, just a second, Dr. Murza. I'm just pausing you. I'm just gonna mute other people because there's some noise.
Sure, sure.
Yeah. Okay. So you can unmute yourself, and then we can start. Yeah.
I would
Okay.
like to know about like family structure, like who all are there in your family and like his siblings.
Okay, it's me, and I got separated from my husband, and I'm just living with my mother and Raza now.
Okay. So, and how is this the condition of Raza affecting like Raza per se and you all? It must be difficult for you all to
I cannot
maintain.
tell you, doctor. It's really difficult. You see, I'm a single mother, and I have to go to work. And then I was just thinking that he'll grow up, and I'll be able to send him to any school or something. But now he has these issues, and then I have to leave him to my mother, and she's old as well, and she's unable to take a lot of care. So things are difficult, yes.
Yeah, I do understand, and I really appreciate you for your like the way you are managing Raza and you are doing the best. Are you getting any financial aids for it from government or any
No,
support?
nothing, doctor, no.
Okay, okay. And how is his siblings coping with him? Like you have
Oh,
any?
he's the only child, doctor.
Sorry for that. Any other important thing which I have not asked you during our discussion today? Would you like to tell me? Which you think?
Yeah, doctor, I feel that, I mean, as I told you that he he doesn't tell his name, but he doesn't speak much a lot. So I'm concerned about that. And at times he's really angry. So I feel that he has some behavior is not good as well. So I don't know, is it because he's unable to do things? And also I'm really concerned about his education. How is that going to happen? And how is he going to deal with all these problems? And will he get better or not?
Yeah. Is he able to tell Mama Dada, Raza? Is he able to speak?
Um, yeah, he at times, yeah, he does call me mama, yes.
Okay. 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 Thank you, Mona, for giving me the opportunity to talk to you regarding Raza, and hopefully we will do the best possible for him.
Okay, thank you, doctor. Okay, so the time's up. Please summarize your case.
So today I got the opportunity to talk to Mona, mother of 3-year-old Raza, who had concerns with regards to his walking. Raza had a history, had a smooth neonatal and antenatal course, and he had a history of fever at the age of 6, and along with fits. And for this, he had multiple fits episode and has been admitted, had multiple episodes of admissions with regards to his refractory fits, which and he is on the care of brain doctor along with the general practitioner for this. He's on fits medicines, and since last 5 months they are control. There is also the family is also is a single mother, and they have separated, and it's like really getting difficult for financially for the mother to manage the things all alone.
Okay. Anything else you want to tell?
So with this, I would like to put Raza that his developmental, it looks to be like his language developmental age is around 9 months to 12 months, whereas his in the
Okay, your time for assessment has started.
okay, I will enter into the room, clean my hands. I will wish the mother and the examiner, and then I will look at Raza. So I am talking to Raza. What is Raza doing now?
He's sitting on the floor and he's playing with some blocks in front of him.
Okay. I will just quickly observe Raza and wish him hello, Raza.
Yeah, he looks at you and then he's busy in his playing.
I will also look at for any abnormal or dysmorphic faces for Raza or any devices which are attached to Raza or near him.
No, they're not device. There are no devices, and they're not no dysmorphic features.
Okay.
His head size looks a bit small. Other than that, no other features.
Okay. And I would also see for his general assessment for his height and weight. Like, is he does he look small or appropriate for age?
Yeah, he looks a bit small for his age.
And hopefully Raza is not in distress. He's okay.
Yes, he's okay.
So Raza, let's have is he able to walk? I'll just ask him, support him, and ask try him to make him walk. Is he able to walk with me?
No.
Okay. So Raza, I will help to with the help of I will ask him and take the help of his mother, and I would like to help him stand. Is he able to stand without is he able to stand without support?
Yes, he's able to stand without support for a few seconds.
Okay, then I will show Raza. Can you just stand like this on the tiptoes? Is he able to stand on the tiptoes?
No.
Okay, and I'll just support Raza and help him walk. Is he able to take any steps with support
Yes,
with
he
my?
can. Yes, he can walk with support.
Okay, and with regards to uh, I have taken a ball in my assessment, and I will just try to kick the ball when he is standing and show him. See, this see Raza, can you just kick this ball for me? Is he able to kick the ball?
Not really, not the proper kick.
Okay, okay. I'll just take the ball and show Raza. Raza, see this ball. I will just throw the ball away, and I will ask Raza to do the same. Can you do this for me? Is he able to throw the ball?
No.
Okay. Okay, then I will just ask his mother. Mother, is he able to with climb up with support?
Sorry, climb up where?
With support, like with two legs on each step.
Okay, climb up the stairs. He can crawl upstairs, but
Okay,
he cannot walk upstairs.
okay. So I will just help ask Raza. Like I'll sit on the floor at the level of Raza and just ask him to get up. Is he able to get up without the support or with support?
Yeah, he's able to get up. Uh, yeah.
Okay. So, and in order to complete my examination, I would like to do a complete neurological examination of Raza along with other developmental milestones in controlled settings and also do a formal assessment of hearing and vision.
Okay. Okay. Anything else?
That's it in assessment.
Okay. So, would you like to describe your findings?
So today I got the opportunity to play with Raza, who is 3 years old and who is able to stand without support, and he is able to like walking is there with support today, and he is not able to climb up and climb up on the stairs. He is not able to kick the ball or throw the ball, and he's not able to stand up without the support of his hands. So with this, I would like to put a gross motor age of him to be around 12 months to 18 months uh, for this. And further, I would like to do a complete further assessment of his neurology and other milestones.
Okay. Okay. So what do you think that Raza has an isolated delay, or does he have a gross global delay?
It looks to be a global developmental delay for Raza, for him, because his gross motor milestones, as I've examined, are delayed, along which he has language milestones which are also delayed for him, and uh, fine motor milestones are also delayed for him. So it looks global.
Okay. Okay. And what do you think is can be the cause of delay?
So in this case, he had like there are causes for which can lead to this delay. Or he had an infection or at the age of 6 months, and which could have an insult in his developing brain. He had refractory seizures for which multiple anti-epileptics are going on. This is also one of the causes, and his family dynamics like are not very like fine. So these all are things are contributing to his delay. And for this, I would like to put like the main cause to be
So what do you think happened at 6 months which led to
so
this issue?
he
Did you
had
assess that the child was able to do things at, uh, did the child achieve the milestones till the 6 months of age?
yeah, I did not. Yeah, in my assessment examination assessment, I was able to get that he was getting around 1 year of age. He was able to do the things till 1 year of age.
Okay.
Not in my history.
Okay.
So I think it is the meningitis which the child had at the age of 6 months, and the bug infection which has caused like the is the main cause of insult.
Okay. So, how would you like to investigate this child?
So, with regards to investigation, I would like to first involve my consultant and would take the help of a multidisciplinary team. And with the help of multidisciplinary team, which will involve my consultant, my brain doctor, neurologist, the occupational therapist, physiotherapist, salt and language therapist,
Yeah,
and
but would you like to investigate anything first?
so in this case, I would like to do for the confirmation of my diagnosis, I would like to do a neuroimaging MRI of the brain for him uh, uh, for this assessment, basically.
Okay. Any other thing?
Mm.
Okay. Okay. So, how would you manage?
So my management will include a multidisciplinary team, including my consultant, along with it, a neurologist, a developmental pediatrician, physiotherapist, an occupational therapist, social worker in this case, and salt and language therapist in this case.
Okay.
Basic.
So, what is the role of physiotherapist?
So the physiotherapist will help in in movements of the joint, proper movements of the joints, and help him in assist in walking, and let the joints not get stiff and contractures not develop.
Okay. What is the
And,
role of
and even
what?
his fine motor skills, he will help in his fine motor skills also.
Okay. What is the role of occupational therapist?
So occupational therapist will help us in setting the environment at home, and when he starts to going to school, the things which are easy for him to use. So those settings will be held with the help of occupational therapist.
Okay. And how can you help the family as the mother family has having certain issues?
So for the family, I would involve a social worker in this case, and would and with the help of social worker, financial support be provided to the mother in this case.
Okay. Okay. So, okay, the time's almost up. Okay. So, how do you feel? How did you do?
I missed points in the history. I needed to be a bit more elaborative.
Yeah. So, Dr. Murtaza, one thing I really want to appreciate is the way you are taking your communication style, your pace, your tone, really nice. very appropriate for the exam. Okay. So you did have a good communication. You did mention the lines in between where you built the rapport, where you showed the concern, where you appreciated, where like so it was really good. Even in the explanation, your way of telling, so it's really really fluent. But we need to work a bit on the structure of how the history and assessment goes. Okay, so if I tell you from the history, initially, as I told you that like yeah, the mother did tell this difficulty in walking, but you cannot really ask that did he ever walk. You need to ask it in a different way, that do you believe that he attained certain skills and then he lost it? You cannot really ask, see, you ask questions like, is he able to walk with support or not? Because that is something that you're going to assess in your examination, right?
Right.
You could not have asked that in the history. One other point that is about your overall thing is that you tend to ask 2 to 3 questions at one time. Like when you ask, say one thing, and then you try to over explain it, and then you explain it. So I think 2 to 3 times I noted that you are saying 2 to 3 lines together,
Hmm.
which at times causes a negative effect, because I was answering to you. So you, I think at one place you answered about the dysmorphic features and the aids at once. Okay.
Right.
So you see, at times what happens that I did tell you that the child is not having hearing aids or like any other aid or the small features. But when you're asking the examiner or the role player, they might confuse it, they might forget to tell you. So make a routine of asking one question at a time and be short and clear in your question, right? That what do you want to ask? Regarding the cause, I think that was okay. You did probe well, but I think you need to be a little bit faster in a sense, because I think you finished early, but there were a lot of points that were missing. So antenatal history, in the natal history, postnatal history, you could have asked certain more things. When I told you about the fits, and then you need to probe about that. What happened? I told you that there was a bug and all. You needed to ask me that was there any specific test done from the brain, anything? What did the doctors tell you? What happened? What medication was started? Things like that. Okay, then
Right.
you really need to work on the history questions of the development. Asking one question is not enough, right? So you ask me that what shape. I told you straight lines. Okay, straight line could be vertical, straight line could be horizontal. They are at 2 different ages. So
True.
you need to be particular about that. Okay. Second thing, you need to ask at least 2 questions, at least 2 questions per domain. So only one line, saying one line is not enough to find an age. Okay. So you had to ask that what, like after the lines, should ask about the blocks at least to have a right idea of the age. Okay, then you ask me, is the child able to tell the name? I said no, which means that I'm not at the age of 3 years. But you did not ask that, like, is the child able to say any words, how many words, right? So you were not able to make a diagnosis or make an age assessment of the expressive language. Then you asked me about the command. You did not ask me one command or two command. Okay, you did not ask me about the body part. So you need to be specific in your questions so that you are able to, it's not just like randomly throwing questions. You are asking questions to make a sense. So it's really important that you listen to that and ask clear questions to have a right idea. Okay. Then in the social one, you asked about the play. I said no, that a child is not share. It means the child is not the age of 3 years, but it did not tell you that what age is the child of. Okay. So I think in that you need to make your questions and you need to ask them and then listen to the answers. Okay. Then you did ask about the like other admissions and all of that and the cycle. So I think if you ask proper 2 questions, you would have, like, I think you did have 30 to 40 seconds left when I told you that there are other issues. Also, I really want to tell you all of you that recently they have started giving 2 things in one case. It's like they are kind of including autism in every case. So be always very particular about asking the behavioral thing in the child. Okay. Then the summary was okay, but I think it could be improved in the assessment. you finished off really early. I think things were fine. You do ask things fine, but you need to be a bit more careful about asking questions and then getting the replies and then interpreting that. Okay. So you could do better in that. And regarding, I think the other things, the best thing I like was the diagnosis, the differential that you gave. That was really nice. You did cover all the important topics that could have been involved in the developmental delay. And regarding the assessments, I think you need to just read again about the physiotherapist, about the occupational therapist. It's not just about the home things. It's about teaching the child all the skills that are needed for the daily life, like even eating, combing hair, things like that. So the occupational therapist teach you all the small skills that are needed for life. So just have good lines prepared about each of the roles so that you can tell them in the exam and they could be like you can get the full marks, right? But a good whole appreciation for you about your way of attempting it, right? All of the things are there. You can just little practice and they'll be good to go.
Thank-
Are you planning to give
yeah,
the exam anytime soon?
yeah, my exam is in January.
Oh, okay. I think you're doing really well. Just a little bit of more practice with anyone who you're practicing with. Okay. And so just the final touches that would make things better, right? Anything you want to ask or anything anyone wants to ask, anything anyone wants to point out? I think we've done it for like we're 1.5 hour into our session. Yeah. Okay. Anything
In the
like,
assessment part also, I think a lot of time was left for me in the assessment part.
yeah, that's fine. That's fine. Because you see, I told you that when you get only gross motor, it gets a bit challenging in exam because we were to practice only the gross motor today. Usually, as I told you, that two domains are roughly coming per like exam. So roughly, it's less like that you get only gross motor. There might be some fine motor assessment or something other that you have to do along with that, which probably take you time. But even if you find early, I would just say that if you have only one domain, then take your time, make things slowly, go slowly, and ask about everything. Even if you have done all of the things and nothing's there, if you find early, that fine. Like I remember one of my colleagues told me that she did 2 minutes early because all of the questions and everything was done, right? So they sat there for 2 minutes and the station was over and the examiner said that you have told everything. So yeah, she got full marks in that one. So that's fine. At times you do finish early in history or at times development examination as well. Okay. Okay,
Okay.
someone's asking behavioral issue in summary to add any other diagnosis like autism. Okay, so specifically not in this one, I would say that in the history, recently they have been giving the cases in the I think last like in the initial first, the second right, there were cases in which they had issues with the autism, but they had issues with the fine motor as well, and they were asked to assess the fine motor examination, but the child did have some features of autism. So they kind of include autism in multiple ways. So you just need to be clear that the child does not have autism. Okay, that's really important to have an idea about that in the developmental. When do we ask about the systemic inquiry, behavior, sleeping, hearing, vision, sleep? You don't need to ask about the detailed systemic inquiry in the development exam. In the developmental station, that's for the long history station. Okay, for the developmental, you need to take a focus history. How do you elicit expressive and receptive speech disorder? Can you please be more clear about that? I mean, expressive are that if the child is not able to speak properly, not able to tell names, rhyming, things like that, color names. And receptive is that the child is not understanding things. So I'm not really sure that what do you want to ask, if you can clear it a bit. So I think we're almost 1.5 hours. Yeah, so Dr. Kunwa, if you can tell me that what exactly you want to ask. Yeah, there's a for the expressive and the receptive, if you go through the developmental charts, there are different things. Like for the receptive, you see three things. Three things are the commands, the like the child is able to do one-step command, the two-step command, and then pointing out the body parts. Is the child able to point one body part, two body parts, or three body parts? And then along with that, the child is able to tell about the noun, proverbs, the language parts. Okay, that's for the receptive one. And then Yeah. Then for the expressive, it's about the number of words, the name, age, things, the counting, color, song, story, and the sentences, these things. Thank you, Dr. Srikanth. Thank you for mentioning that. So any comments? If any would like, what question do you ask to know if the child has hearing problems? Yeah, for that, if you're having speech and language issues, then you need to ask that, was the hearing screening done? And then there might be history of recurrent ear infections. There might be history of some ototoxic drugs or meningitis that has led to the sensorineural hearing loss. Okay, and yeah, so that would lead, or the child might have some hearing aid present when you are see. If the assessment is about language and social assessment, can we ask about, yeah, you can ask about the hearing assessment. That's fine. That's not about, you can ask about that and the vision as well. Yeah, for the specific, there are, you can always go to the NHS websites and they have written material on the role of all of the therapists. So you can just write down what the role of physiotherapist and you can have multiple sources and you can like see the roles similar one, but you can have good lines to prepare to tell in the exam. Yeah, all of these things, the education healthcare plan, yes, this is important in the developmental station. EHCP, if you write EHCP, you can have a document share. I'll share the educational healthcare plan link in the clinical group. If you are in the clinical group, I'll share a link for that and you can read from there. Okay, so thank you so much, everyone. If anyone has any comments, I would really appreciate if you have any suggestions, anything. If I hope it was beneficial for you, and you did get to learn something from today, and hopefully it will help you in your exam. Okay, thank you so much for taking the time out and listening and actively participating. Thank you, Dr. Murtaza. I hope it was helpful to you, and due to like with your help, I think it was helpful for other people as well. So do give feedback in the group as well, and we will plan another free webinar soon, and we'll get the any other candidates, you can always volunteer for that. And if you have any queries regarding any of that, we like I'm the one person who, if you are in the MedPrep online group, I am daily posting something there, and I'm there to answer all of your queries. So whatever queries that you have in your mind, you can ask in the group as well, the WhatsApp group. And yeah, so thank you so much, everyone. I truly thank all of you. Best of luck for your preparation. Best of luck for your exam. See you next time and have a very good night. Bye bye, everyone. Thank you.